Hi everyone. Yes, I'm a nurse practitioner. I originally grew up in Pennsylvania and now I'm out here in San Diego with all of you. So welcome, thanks for listening. I have a clinic called Joy Wellness Partners, which opened in 2016, and now we've grown to offer a lot of different alternative services, including hormone balancing, testosterone optimization, or helping men and women through the aging process optimally. We try to strive to use non-medication therapies to help people live their optimal lives. We do IV infusions, a lot of immune boosting, and some COVID treatment testing strategies during this time. We also do a lot of ultrasound guided procedures, which basically means if you have back pain, neck pain, shoulder pain, injuries, trauma, like Achilles tendons, we see a lot of knee injuries. We'll treat them with stem cell therapies and other regenerative non-surgical techniques. So a lot of military, a lot of civilian, both come far and wide to receive treatments, and we try to make it available at a cost-effective price, and we do offer military discounts for certain services, like the one we're going to talk about, really specialized today. Basically, the topic today is one of our more up-and-coming regenerative ultrasound-guided procedures called the Stellate Ganglion Block. Wow, it's amazing how it's not as widely aware, or the awareness isn't as widely out there as many of us would expect, or in my field. I'm just so glad that we get to share this with you. So the Stellate Ganglion Block, really in a nutshell, it's like the reset button for your nervous system and for your overstressed brain. So basically the stellate ganglion is just a bundle of nerve fibers that exist outside of your spinal cord in your neck. There's one on the left side and one on the right side of every person's neck. The stellate ganglion block is using anesthetic to turn off the message of that nervous firing, the signal from the body to the brain. And it's been used since the 1930s. So it's almost a 90-year-old procedure. So it's interesting how little the awareness is about it, but basically it was being used for many, many years for pain treatment by anesthesiologists. So anesthesiologists would use this procedure for treating things like reflex sympathetic dystrophy and chronic regional pain syndrome, or fibromyalgia, or treatments for pain that was inappropriate to the presentation of the patient. So somebody would say, hey doc, my elbow, my arm, everything just hurts incredibly much, 10 out of 10 all the time. And they could find nothing wrong in the MRI or the x-ray, and they would say, well, let's do a stellate block to try to reset the pain signal to the brain, because it seems like this is a neurologic problem more than it is an anatomical injury problem. And this was also used, maybe you've heard of phantom limb pain. It's a similar thing where somebody has a traumatic injury, loses a limb, and they have excruciating pain in their foot that doesn't exist. So we found that traumatic injuries cause an inappropriate signal to the brain. Dr. Sean Mulvaney was the first one to translate that stellate ganglion block from treating pain to treating combat-related PTSD, or post-traumatic stress injury, which we like to call it. So in 2008, Dr. Sean Mulvaney, who was originally a Navy SEAL on the East Coast primarily, he became a U.S. Army physician, and he has since retired the last year or two as a full bird colonel in the Army. But he was active duty as well as serving as a physician for the last few years of his career. And during that time, he saw a lot of PTSI. He would call it post-traumatic stress injury. His SEALs and his other patients would come in to his clinic near Walter Reed over in Maryland and would say, doc, I can't deploy again, I just can't go out, I'm not safe for my guys. And Dr. Mulvaney would be like, what do you mean? You're the top of your class, you're at the top of your game, why can't you be deployable? He'd say, I just have 10 conversations going on in my head all the time, I can't focus, I can't sleep, I have uncontrollable outbursts, I don't know how to lead my guys because I feel like I'm a mess. And Dr. Mulvaney said, he came to Dr. Mulvaney knowing he could trust him as a guy who knew what he was going through, and he said, how can you help me, doc? So Dr. Mulvaney first tried the stellate ganglion block using ultrasound guidance for these guys. He said, you know what, I don't have any proof that this is gonna work for bringing down your stress that you're going through, but I'd rather try this if you're willing to give it a try than prescribing you medications or telling you you're non-deployable. So these guys said, yeah, doc, what do I have to lose? And he said, well, it's It's a very low side effect profile. The procedure takes about 10 minutes to do. Let's try it. And instantly, within about 10-20 minutes after the procedure, this guy was brought down from that hyper fight or flight response that he couldn't get out of. And Dr. Mulvaney started to use this procedure for the next 10 seals that came through, and then the next 100, and then he started doing research. And in November of 2019, he finally published a double-blind case-controlled trial which showed that the stellate ganglion block was twice as effective as placebo for treating post-traumatic stress injury and post-traumatic stress disorder. So in addition, the Veterans Affairs hospitals have started to take Dr. Mulvaney's training and bring it to different hospitals and make the stellate ganglion block available for veterans. This is still a very slow process, and there's very few doctors that know how to do this procedure or who feel comfortable doing this procedure in the VA. But we're trying to train them. Dr. Mulvaney is one of our colleagues. He trained me, he trained my colleague who works in my clinic, and the doctor that also does these procedures in our clinic. And so we always try to stay on the cutting edge of doing this procedure the most safe way possible. And again, you can see 90% of the individuals who had this procedure saw a significant reduction in their fight or flight response syndrome. So basically, this is a picture of what it would look like if a patient would come into the clinic and get the procedure. This is a picture of Dr. Mulvaney doing the procedure on Dakota Meyer, a Medal of Honor recipient who many of you may know. Dakota Meyer is one of the ones who really brought the stellate ganglion block to the forefront of a lot of social media and a lot of individuals' attention when he spoke on the Joe Rogan podcast. He shared how the procedure was so quick, and basically in our clinic is very similar to how, like I said, Dr. Mulvaney and the different individuals around are being trained to do the procedure. Ultrasound is used not only for looking at a baby, but it's also being used for guiding an injection into the right location. So basically we have a long needle that's very, very thin, tiny diameter, feels very, very minimal pain. The needle goes to the stellate ganglion, which is about 2 inches, in, maybe not even 2 inches into the neck. And it puts about 9 or 10 milliliters of the long-acting anesthetic called ropivacaine around the nerve, and it basically blocks the nerve. Like you're getting a tooth, pulled, you get the nerve blocked so that you don't feel the pain. That's all it is, but it's so precise and so risky because of the high real estate area of your neck with the arteries and the veins and the nerves that you really have to have a precise application of this anesthetic so that the anesthetic goes exactly where it's supposed to and nowhere else. After an hour of monitoring the patient, we want to make sure that the patient has the appropriate response to prove that we got the block in the right place, which means we want to see something called Horner syndrome, which is a red, droopy eye, droopy smile. You look like you're high on half the side of your face. It's the expected response to prove that we got the stellate blocked. And that's just the response for the 6 hours after the procedure. That always goes away because the anesthetic always wears off, and the patient's basically in that state of turning off the gas pedal to the brain for 6 hours. After that 6 hours, the patient feels many, many times, most of the time, like a backpack's been lifted off their shoulders, like a weight's been lifted off their chest. Even within 10 minutes after the procedure, many patients will say, "Doc, I can breathe easier." We do a heart rate monitor, and many people's heart rate drops 10 beats a minute within 10 minutes. And additionally, individuals that do their heart rate monitoring at their house, they'll come back to us and say a month later, "Hey, my heart rate is still less by 10 beats a minute every day. I can walk more slowly. I can breathe more easily. I can enjoy the sunset for the first time. I don't have to hyperreact when my kids, drop another toy on the floor. And when my wife leaves a sock on the floor, I don't scream at her because it's just a 1 out of 10. It doesn't hyperreact to 10 out of 10 every time anymore." So they just, okay, sock on the floor, pick it up, put it in the laundry. These people that have had the block will try so hard to get their colleagues in their community to come in and get the block too, because they notice that compared to other treatments, it's safe, it's no side effects, no drug like addiction or tendencies to feel like you're not getting anywhere with what you're trying. Additionally, psychiatrists, psychotherapists, counselors will recommend their patients come to us first before they do counseling, because it just takes you off the edge of the cliff, helps you to get into a place where your brain is able to respond to counseling and to therapy. the 2-week follow-up phone call and then 2-month follow-up, and we were now doing a research project with my colleague Lindsay and another nurse practitioner who's doing her doctorate program in order to help to develop more research around what are the specific symptoms and how much do they improve with the stellate block. You know, how much is your sleep improved and what percentage of people do they have a reduction in their angry outbursts. Again, here's the picture of Dakota Meyer talking to Dr. Mulvaney, sharing his story. And you can look this up on 60 Minutes. That was June 16th, I believe, a couple of years ago. But he stated, just for an example, someone many of you may know, it instantly took me from being like my whole life was downtown New York City in rush hour traffic, 15 minutes late to a meeting that my life depended on, to instantly being driven down a quiet country road with nowhere to be, instantly. And his story is all over YouTube if you want to look it up and watch his testimonial, because he shares it in a really human way that everybody can understand. Again, we talked about the potential benefits, which is really what I want to highlight here, because we don't believe that post-traumatic stress disorder or a overactive stress response in your body is something that you have to live with your whole life. We believe it's like a broken arm and you put the cast on and you heal it. We believe this is something you can heal from and you can get to the other side of, which is kind of one of the things we want to expand the awareness of to anesthesiologists that already know how to do this procedure and enable them to do this for more people that may be able to expand the diagnosis of what your criteria would be for getting this procedure. Because a lot of people will say, am I a candidate? Am I a candidate? And there's very limited number of people who are not candidates for this procedure. It can help you with better sleep, improve your clarity, your mental concentration, your focus. You know, when you would read a textbook and it would take you like 10 hours to read 10 pages, and like to switch from one idea to the next was just so slow for your brain, like a computer that was just on this, like, you know, going around the drain forever. Now the stellate block enables you to switch from window to window to window, close that window, open the next one, close that, you know, page, open the next one, switch from training to combat to home without a hardship, without a stress for the brain. We find a lot of people reduce their frequency of panic attacks, reduce their frequency of headaches and overall social anxiety, as well as get more quality sleep. Additionally, the intimacy, the sexual function that can decline when the body is in this running from the lion in the jungle, sympathetic overdrive, that can improve dramatically with the stellate block too. So we do free consultations. We have, again, it's East Village, downtown San Diego. It's pretty close to here, close to the airport. There's very few places around the country that offer this. Again, we're trying to increase the ability for different places around the country to do this safely. But we have a place, there's a place in Maryland where Dr. Mulvaney works. There's a place in Chicago, Dr. Lipov, but we're the most reasonably priced in this, you know, Southern California, Southern US region. There might be one place in San Francisco, but again, we try to keep the price very accessible. So you'd be looking at between, you know, around $1,000, $150 with the gift certificate or with the military discount. Again, the procedure, people ask, how long does it last? Many people, it will last indefinitely if their stress experience was a one-time incident in the past. So they come back from a deployment, they're retiring. This is a great way to reset and get back to normalcy for life. Other people that are continually going back and forth into traumatic situations or into stressful experiences, they'll use this procedure as kind of a maintenance every year, every 2 years. And basically, you know, the 90% effectiveness is on the right side where the injection is typically given. We actually find that there's a few people, about half of the people that don't respond on the right respond really powerfully on the left. So sometimes people have to get it repeated on the left side just because it wasn't the right side for them. Like some people's hearts are on the left side or on the right side of their body. So you can do a brain scan, like a QEEG, to determine maybe what's the better side. But the research is all based on the right side, where 90% of people have the positive response the first time. The way to determine candidacy, we send a questionnaire out to people, but it's available on the VA website. It's called the PCL score. So PCL on the VA website, if you just look up PCL, VA or military. Unfortunately, like insurances, they won't cover it. So when people do this procedure in the hospital with an anesthesiologist, with the surgical cost, the cost is about $5,000, and the insurance might only cover like 500 of it. So even for us in our clinic, we don't take insurance because it enables us to do more alternative services and to stay, because sometimes the insurances will change, the government will change what they want to cover and what they don't want to cover. So we just avoid all that by helping people have direct access and just pay and just get it. But there are foundations that do support this. There's a couple, like Wounded Warrior has supported it. You can write a letter, I can help you sign it, and help to get funding or support. We have some payment plans available, and the VA, when you go to the doctors and try to find a place, I think Long Beach VA has the most doctors that were trained in it. There might be some over on the East Coast too, but they're few and far between, and a lot of them want you to do a long process before you get to that point where you're desperately needing it or you're on their list. So we just help you get it. You can book it and get in within 7 days of calling. So that's kind of the challenge and the way that we try to make it accessible. But yeah, it's the most affordable. Like if you look it up in Mexico, they're charging $2,000 for it. If you look it up in other places, they're charging $3,000 to $4,000 for it. But we try to keep it as low as we can just to make it accessible.